Recently, one of my relatives, my cousin, about 41 years of age, very young man, very dynamic person. He was a hypertensive. He was having BP. He was a hypertensive. He was coming out of the UK airport. He had some work in UK. Suddenly, he had some weakness in the right upper limb and right lower limb. So he just sat there, and immediately he was becoming drowsy. So he was taken to the nearest hospital, where they said he's having very high hypertension, like 180 by 120. That's why he went into a cerebral hemorrhage, that is bleeding in the brain. There are one or two, this we call it as stroke. We call it as a stroke. It can be bleeding inside the brain, or outside the brain, inside the brain, or there can be a clot in the blood vessels which are going to the brain, so that one area in the brain will not get blood. Okay, this is called ischemia. So there can be a bleed, there can be a small bleed, or there can be a small part of ischemia. Ischemia means bloodlessness. There is no blood is going there. This is called ischemia. So if it is a small thing, the patient will recover, like a simple light paralysis, and later recovering with physiotherapy, etc. But sometimes the patient can have a massive bleeding inside, or massive ischemia here, and in 3 to 4 places they will have ischemic damage or bleeding heavily inside. They cannot, these patients will not survive. What I wanted to tell you is, treat the hypertension very seriously. See, my cousin, what he was doing is, he was taking one tablet for hypertension since long back. So many times I asked him, are you taking sugar tablet, BP tablets? He used to say, yes, I regularly take in the morning, I am just carrying out. He never got checked again. About 6 months, last 6 months back I checked once. Later he never allowed me to check. He was taking the tablet. This is what is happening with most of the patients. They don't bother. Once some doctor writes a BP tablet, they go on taking it. They don't forget it. They don't take, but it's not enough. BP, if you go to a doctor for hypertension, for BP, he writes a medicine at that time depending on your situation. Later, every 2 weeks, every week, like that, for some time you have to get your BP checked, or at least nowadays the instruments are available everywhere. You can get it checked in the home itself. So please check your BP periodically, because one tablet is not sufficient always. Sometimes there is a second drug therapy, that is single drug therapy, second drug, 2 drug treatment, 3 drug treatment, 4 drug, like that. I went up to 4 drug treatment till recently. 3 years back I was taking 4 tablets for hypertension. So please remember, one tablet is not sufficient. For hypertension, there are multiple varieties of tablets, calcium channel blockers. There are so many. Some diuretics, angiotensin blockers, centrally acting drugs. So many. There are 5 to 6 varieties of medicines. Why they are? It is only when one tablet, particular type of medicine is not acting, then they add the second tablet, again the third tablet, again also the fourth tablet. There are so many people who are on 4 or 5 drugs daily. Okay, even myself, I was on 4 drugs daily. So please remember, one tablet written by somebody for lifelong is not sufficient. You have to check the BP regularly and see that you get the correct treatment, your BP should be not more than 130 by 80. Remember it, 130 by 80 is the upper limit for your hypertension. Maximum 140 by 80. Don't cross it. So the thing is, I initially in my first videos, video 1, video 2, video 3, I made 3 videos. How to come out of this hypertension, how to come out of diabetes, thyroid and obesity under the name metabolic syndrome. 3 videos I made. Please try to follow, try to see the videos and try to follow the course, the exercise, the diet. Try to follow. First 3 videos of me, they are only exclusively to get back you to normal stage. Now I am using, previously I was using 4 tablets a day for hypertension. Now I am using single tablet, very much controlled. Diabetes has gone. I am not using any medication for diabetes, and no thyroid now, no obesity. I have come down by about 20-25 kgs. I am absolutely normal. Please be aware.